Applications of EEG neurofeedback, a short overview of applied neuroscience. So what exactly is neurofeedback?
Everything we think, feel, and do is the result of the activity of billions of neurons in our brain, and the result of this activity produces EEG, or brainwaves, that we can measure. Research shows that it's possible to train these brainwaves to improve brain function, and this is called neurofeedback therapy.
Brain waves with a lower frequency like delta, theta and alpha refer to states of relaxation like deep sleep, light sleep and general mental relaxation, while higher frequencies like beta waves refer to fight or flight responses, or like gamma waves to the formation of ideas, language, memory processing and various types of learning.
Where is neurofeedback applied? Neurofeedback has been around since the 1950s and is used mainly in clinical practice to help people with conditions like ADHD, learning disorders, anxiety, depression, chronic pain, or migraine, for example. Procedure. At the beginning of a typical neurofeedback session, an electrode cap is attached to the head of every participant, which is used to create an EEG. The measurement is painless because the electrodes only have a measuring function. Therefore, the brain activity can be measured over the whole period of the training. It's been measured at which location in the brain which activities are pronounced how strongly. The results will be compared to medical databases to indicate which activities are pronounced stronger or weaker in comparison to a healthy person of the same age and gender. Thereby, imbalances in brain activity can be shown. Based on these results, an individual training protocol will be constructed. During the training session, the participant stays attached to the electrodes and watches, for example, a movie that is changing the size of the screen and volume of the audio. This depends on how much of a specific activity is pronounced in the brain, which is determined by exceeding or falling below a certain level of brain activity. If the size of the screen is getting smaller, a specific brain activity is too weak. If it's getting stronger, the screen will be getting bigger and the sound will be audible again. Strengthening of a specific brain activity will therefore be rewarded. The brain is trying to self-regulate in which condition the screen is getting bigger. The training parameters are permanently monitored and individually changed if needed to take care that the training is never too easy or too difficult. This is done by adjusting the threshold of brain activity. First noticeable effects of the neurofeedback training appear after 5 to 7 sessions. In a neurofeedback therapy, 15 to 20 sessions should take place. The most prominent disorder which is treated with neurofeedback may probably be the attention deficit hyperactivity disorder, or ADHD. Evidence suggests that the malfunction of the right frontal lobe is the cause of ADHD. The resulting symptoms are inattention, distractibility, hyperactivity, and extreme dispassionateness. Neurofeedback therapy is a rehabilitation approach for its treatment. Its goal is to normalize the behavior without dependence on medications or behavioral therapy. Neurofeedback is associated with its long-term improvement. Studies showed that people with ADHD disorder have slower theta brain wave activity and less beta activity compared to normal people. In ADHD, the goal is to decrease the brain activity in the theta band and to increase its activity in the beta band, or to decrease the theta-beta ratio at the vertex. This treatment is effective in reducing hyperactivity, increasing focus, grades, parental consent from children's behavior, and improving indicators of sustained attention. Furthermore, neurofeedback is applied for treating autism. The autistic spectrum disorder, or ASD, is a neurodevelopmental disorder with challenges that maintain in adulthood. One of the primary symptoms of ASD is a qualitative impairment in social interactions related to mutual interests, understanding others' intentions, empathy, feeling of others, and emotional reciprocity. There are several diagnostic tools designed to show abnormalities in brain functions for autism. They are high beta activity related to anxiety, the high activity of delta theta corresponding to the slow cortex, lack of attention, impulsivity, and hyperactivity, and an abnormal EEG or seizure activity. The high beta type is the most common one seen among children with ASD, with approximately about 50 to 60% of individuals. The goal of neurofeedback in children with autism is to inhibit the theta-alpha ratio while enhancing the beta waves. Efficiency of neurofeedback in children diagnosed with autism has been well researched in qualitative case studies. Apart from its use in clinical practice, neurofeedback training is also applied in competitive sport, music, meditation, or top management as a natural method to increase focus and to relieve stress. Alex is a baseball player who wants to increase his performance and accuracy in the next games. Therefore, he's trying to improve his psychological skills with neurofeedback training. These skills can be applied in practice and competition and can lead to improved athletic performance due to increased focus and decreased stress and anxiety level. Sandra loves to meditate. With EEG neurofeedback, she's trying to increase her state mindfulness during focused attention meditation. It's a method to train, improve, and develop attention and emotion regulation. Deeper states of meditation can be achieved.
Overall, the method has proven to be a very effective way of improving focus and decreasing stress to help patients in clinical practice. In comparison to, for instance, deep brain stimulation, neurofeedback is a therapy process over not less than 15 to 20 sessions. Nonetheless, the method is non-invasive, which means there are no surgical risks, but also in general the method only has limited risks. The only thing potentially going wrong is constructing a wrong training protocol and not tweaking the right brain functions, resulting in undesirable outcomes such as nausea, anxiety, depression, or epileptic seizures. However, these side effects last only for a short period of time. Another great potential of EEG neurofeedback is the application in virtual reality to achieve even more convincing results. Thanks for your attention.